One of the bills that I wrote for a law actually encompassed the requirement that insurance companies pay for midwifery care in the out-of-hospital setting. In 2005 and 2006, we didn't have that. The only insurer that would cover us would be Medicaid itself. So you had to make a decision: do you pay for your health insurance premiums and buy food for your family, or do you pay for your health care in a setting where you feel is safest and the most equitable for you? And it became a ridiculous conversation. And so I helped author a law and lobbied for it, and we got it passed, that required health insurance companies in the state of New Hampshire to pay for midwifery services in the out-of-hospital setting. I think it's unequitable to ask people to pay for all the things and pay for their care out of pocket. Insurance and Medicaid exist for a reason. It's to allow us to not have to be victim to our healthcare bills. An awful lot of out-of-hospital providers don't accept insurances whatsoever, and they certainly don't accept insurance that doesn't pay you very well. And while I understand that from a provider standpoint, from somebody who works, you don't want to work for poor reimbursement, I also want people to know that they're important to me, and that if their health insurance plan pays for maternity services, they should be able to choose this as an option. We find that the state's poorest families now, and the state's families that are on the Medicaid system, often have very, very few options for maternity care. We had a maternity care desert in this state. One of the other things that happened was they required malpractice insurance of the midwifery providers that were going to be in network. So it eliminated all the midwifery providers who were Medicaid providers that could not afford malpractice insurance. And so we're back to square one for our state's Medicaid families. And that feels really awful to me. So my takeaway from that is that I feel like the birth center model has higher value care. More time and effort is placed into the care that goes into it. Their outcomes are better. Breastfeeding rates are longer. Your vaginal rates of birth are much higher. VBAC rates are absolutely outstanding. Satisfaction is much higher. And so it's a far less expensive type of care.